My name is Liza. I'm a GP mainly in Te Awamutu, and I'm also the National Clinical Lead for the General Practice Education Programme, and I just wanted to say thank you so very much to all of you for giving me the opportunity to come and talk to you today. It is a real privilege to be in front of the future leaders of New Zealand healthcare. And I think the fact that you've all given up a weekend to think about leadership and what you can do is pretty admirable. So my talk, so I've done a diploma in strategic leadership and I'm also a GP. So what I want to do is try and entwine for you over the next 35 minutes a little bit of the stories of general practice to possibly give you a different insight into general practice and what leadership looks like in primary care. I also want to share with you some of the learnings that I've picked up from the Diploma of Strategic Leadership, although there were many, so just a few. And I'm going to do that by telling you some stories because really general practice is very much based on stories. So here we go. So first of all, I think it's really important that I define general practice, and I know that lots of you have done general practice runs and some of you may have GP mums and dads, but I want to talk to you about what I think GP is in the context of it being different from anything else. So the bread and butter of general practice is managing illness. And the difference between that, as you all know, is that that is the context of a disease in an individual, what it means for them. And we manage illness for the patient, but we also manage illness for a lot of other people. Because what we recognise is that you can suffer from an illness that you don't have. So let me tell you my story. So my father had renal failure and a stroke. So he was on dialysis. So I watched him suffer a lot because of that. But the person who suffered probably as much, if not more, was my mother. Because she had the renal diet. She mopped up the blood when he had a blood bleed after dialysis. And she kind of protected the rest of the family from having to do too much caring of him so that we could get on with the rest of our lives. This is the nature of general practice that we deal with. This is our territory. We're really fortunate that we do a lot of our work in teams, and I was so touched by that first comment about that 6-year-old on the bridge and her saying, "I believe in you, and that's why I think you can come across this bridge." Because I'm going to argue for you that all GPs are leaders, because that's what we do every day. We say to our people, "I believe in you, and I think you can walk across this bridge. And even if you don't, I still believe in you." So we have a very intimate relationship with our patients and our communities. And it's in those communities that we do that leadership. And it's quiet and it's subtle. But it's very powerful for the people who are trying to get across the bridge. Oops, wrong way. So the thing about general practice is that we're a no-wall society. Okay? We're not leaders who want to build walls. We're leaders who break down walls. And we do a lot of our work in the context of places that aren't just our surgeries. So some of us work in school clinics, and I did that for quite some time, and it was a real privilege. And what I want to talk to you about in the context of this is, how many of you have read any of Don Berwick's work? Okay, well, write his name down because he's a fantastic leader in general practice. He writes beautifully. His father was a GP, and he talks about the fact that general practitioners are the holders of secrets in a community. And that's very much what we do. We know about what's going on with different people, and we live and work in that community, and we hold those secrets. So an example of that for me was that I was in our local pub, and I never actually acknowledge anyone from the school clinic because it's a separate clinic away from the surgery. And part of it is that it provides confidentiality for that group of people who often don't have it. So I never acknowledge the young people that I'd seen in the school clinic. And we were in the pub, and two of the ladies were in the pub as well. Very beautiful, glamorous ladies. And I was there with my two sons. And I could see them nudging one another and looking over and going, have you seen them over there? And I had not acknowledged these two young women who I knew quite well. And earlier that day, my son had said to me, "Oh, Mum, you're so last century." So then, of course, what was lovely and delightful was they actually went, "Oh, Liza, hi," like this. And my son looked at me, and I said, do you know them? Do you know them, Mum? I said, "Yes, actually, I know them." And they don't think that I'm last century at all. Whoops, I'm not very good at this, am I? Okay, so the other thing we do is that we sometimes do visits to farms and things, but the reason that I've got this up for you is because I want to talk to you about the pathways, which are fantastic, and we do use them. But equally, we also have to contextualise them to our communities. So if a farmer comes in to see us at calving time with an injury, we do not follow the pathways. We refer them straight away and get x-rays straight away, because any of you come from farming stock? So you know that they wouldn't have come to the surgery at calving time unless they had an injury. So the fact that they've even walked through the door is a diagnosis in itself. Oops, there we go. Okay, so who are we? Who are this group of leaders in the community? Well, actually we're a pretty diverse and eclectic bunch. And so how do we work together? Well, I think those of us that work well together share a vision and a passion for providing really good community-based care to the communities that we serve. So we've got two of our lovely leaders here. We've got Richard Medlicott. He's actually the medical director of the college. And we've got Alice Tate Jameson, and she's one of our young Māori doctors, who's a bit of a superstar. So I'm going to show you a few others. Do any of you know Olivia? Olivia is actually a GP here in Christchurch, and she's also a GP academic and a mum. Jethro's one of our Māori young GPs, and he works in Papamoa. He's done some of the clinics where you fly over to Motiti Island, and he's also been heavily involved in smoking cessation. This is him and his family on the beach. And this is KJ Patel, who works in Havelock North and is heavily into quality and works on the Quality Commission at the college. So I just want to stop and think, because really this is a leadership forum. I want to think about what is leadership. So I would really recommend to you some of the work of John Maxwell. He's written some really neat books about leadership and teams. And John Maxwell says that leadership isn't about titles, positions, or flow charts. It's about one life influencing another. So that's another reason why I would argue that all GPs are leaders. Having said that, what makes a good leader? Well, I very much believe in the concept of servant leadership. Have any of you heard about that? So Servant leadership was written about by a guy called Robert Greenleaf. And he says that servant leadership is a philosophy and a set of practices that enriches the lives of individuals, builds better organisations, and ultimately creates a more just and caring world. In essence, it's not about me, it's about them. So I want to now give you some examples of how GPs lead from the heart of our communities. Do any of you know who this picture is by? Have you seen it before? Many times, I would think. So the picture is by a guy called Sir Luke Fields, and it's actually massive. Have any of you seen it? It's at the Tate Gallery in London, and it's actually huge. It takes up the whole side of a wall. So this is, I think, where we do our most important leading. This is where we work with our communities in times of difficulties and our families in times of difficulties. This is where we take people and we move them to the new normal. So there's lots of what we do, there's lots of what we see that we cannot cure. We can't cure the woman whose son has just died, and we can't surgically remove the terminal cancer. But we can help patients and their families adjust, and we can stay the course and walk the journey. And leading a good death is one of the best privileges that any doctor can do, I believe. Here's a more happy slide. So this is about the fact that we work within teams, and this is a team that's got their cornerstone quality certificate. So we're really striving to improve the quality of services provided in general practice. And I've got this here because I think that another really important aspect of leadership is followership. So sometimes you're not the right person to lead and someone else is the better one to do that. And often in the context of these quality issues with our teams in general practice, it's our nurses and receptionists and practice managers who have the core skills to get us through this. And it's really important that as GPs that we follow rather than lead. Occasionally, we have to lead when we least expect it. There's a few smiling faces down the front. Tell me why you're smiling. There you go. Fantastic. So, this happened very quickly, and KJ and a lot of his team were at the forefront of this, trying to work out, one day when suddenly everyone starts to get sick, what's actually going on and how they can help and how they can advocate within their community for making sure that people remain well. And I don't need to tell you here about the great work that people and GPs, all medical professionals, do at a time of natural disaster and continue to do after it. So the work of the health professionals here in Christchurch has been second to none, and everybody really does acknowledge the leadership that all of them has shown, because and it may well be that some of you in the room are also affected by this, and I acknowledge that. But dealing with other people's issues is very hard, but when they're also your own, when it's also your house, when and your family, and everyone put all mills to the pump. And the GPs in particular that I can talk about, had GP surgeries that weren't up to scratch and just muddled through and went to garages and went to houses and did whatever they could. So that ability to adapt and just crack on is a key sort of form of leadership. As GPs, a lot of us live and work in our communities, and that can be quite tricky. But also it can be really give the joy of general practice. So many surgeries actually join in with the Santa Parade and actually present a float, and if the doctor's not actually on that float, he or she may well be on another float for the football team or the BMX bike team or whatever else. Lots of doctors are also coaches of local football teams, etc., etc. So within a community, you have multiple different leadership roles. But of course, what I'm acknowledging here with the hats is that you've always got your doctor's hat on. So, if somebody does fall or break their leg or whatever else, it's going to be you as the GP who comes along and has to deal with that. So managing yourself as a person within a community can be quite tricky, but lots of us are really supported by our communities, and that's the joy of what happens. And the patients do come to understand that unless, of course, there's an accident on the football field or somebody falls off the Santa's float, that they come to see you in the surgery for what they need to see you medically for. So now I want to go bigger, and I just want to highlight and illuminate to you some of the opportunities that are there in general practice. So we have a lot of GPs who actually, aligned with their general practice career, have an academic career. We have our own academic journal, which is published online. And there's a great deal of work that's going on with the Department of General Practice here and the Department of General Practice in Auckland in terms of rural health and the health of New Zealand, etc., etc. So it's possible to have a hybrid leadership roles. It's also possible to have political roles, and I acknowledged what your president said at the beginning, that getting involved in politics may or may not be of use, and I think I hear that comment, but in terms of advocacy for the community, if you can deliver messages that means that the politicians need to sit up and listen. So, for example, if you did think more about the housing message as a group, then that is what happened. So the big piece of work that the college has been doing has been very much around workforce issues, and the fact that we need more general practitioners and that we need to be able to train more general practitioners, and we need to have working conditions in general practice that means that people can live a sustainable and happy life. So there's lots of opportunity in terms of political careers in community-based leadership as well. This is Tim Malloy, who's our president, and you all know who the other gentleman is. We have lots of leaders who have high-powered jobs. So Mark Peterson was a former head of the NZMA, and he works in a PHO. And I've just picked names just so that I'm giving you examples. Jonathan Fox used to be the president of the college, and now he does a lot of work with the medical council, and he actually accredits a lot of the universities through the AMC. Kate has done a lot of work with the NZMA, and also she's a GP in Walksworth. So there are opportunities. People, work rurally and then come and have central roles. So that's part of the joy, really, is that you can be your own leader. So it's often said that in order to lead, you need to lead yourself first. So a lot of these people have carved these careers for themselves, but it's very possible to do that in general practice. So for me, when I started, I was really focused on being a GP and having my family. But then as they got older, I was really interested in education. So that's the route I went down that's led me to being the lead of the program. So that's part of the joy of community-based leadership, is that you can move and shuffle into different arenas. Whoops. Also, some of our GPs are working on the world stage. So this is the World Organisation of Family Physicians. And so the gentleman with the tie on, some of you may know as Joe Scott Jones. He's a GP in Apotiki. And he's doing a lot of work with this organisation on rural health. So he goes to the conferences all over the world and leads the forum on that issue. And then between conferences is in communication, workshops via Zoom, really exciting stuff. Tane has done a lot of work on Indigenous health with Wonka. And he actually sort of set up the original sort of Indigenous forum. And Helen Rodenberg works at the ministry. She works at Wonka, and her sort of portfolio is mental health. But she's also a GP at Island Bay Medical Centre in Wellington. So I think what I've tried to show you, and we've managed to catch up with time a little bit, is that this isn't a promotional exercise for you all to be GPs, although we would love to have you, okay? What it is I just wanted to illuminate for you the areas of leadership that GPs are involved in. And that was so that if any of you are thinking about GP as a career, you're aware of the diversity of leadership that you could get involved in. It's also to show you that there are community leaders out there that if you've got any issues and you're secondary care leaders, let's work together. We've all got the same agenda. Let's work together to try and get the things done, because we'll be much more powerful that way. And this is really to show you that in a community setting, you can have a stethoscope and multiple leadership hats. Having said that, I'd like to return to our relationships with our patients. Because in truth, I think that is the most rewarding part of leadership in community care. And if you are a community-based doctor, then going to the supermarket is never a fast mission. In fact, it's a ward round. And that's something that you just get used to. So there are a few tricks to it. The first one is to give yourself plenty of time. The second one is to not buy any alcohol or chocolate and to get someone external from your community to bring that in for you quietly. But seriously, though, it's such a privilege to quietly push your trolley around the supermarket, but then stop for a few minutes to talk to the person who has just become a widow or a widower and is now shopping for one. It's also a privilege to see the baby who's arrived after 4 times IVF. So hopefully I've enabled you to see, and I'm sure you knew already, that there's lots of leadership that goes on in the community. And I, again, congratulate you all for thinking about leadership so early, and look forward to seeing and working with many of you in the future. Thank you.